Overdose mortality rates tend to be comparable in urban and rural areas, but given that the vast majority of people in the U.S. live in cities, that makes the magnitude and the scale of the problem of overdose and overdose mortality much greater in cities. SROs stands for single room occupancy buildings, also sometimes called residential hotels. They're an important form of affordable housing, common in cities in North America. In 2018, there were over 500 SRO buildings in San Francisco, which accounted for about 5% of all housing units in the city. Given the ongoing overdose crisis and the key role of SRO buildings in housing some of our city's most vulnerable residents, better understanding the scale and the nature of the risk of overdose mortality in these settings could help reduce drug-related mortality in some of the highest risk areas in the city. So in this study, we sought to estimate the overdose mortality rate among residents of SRO buildings and compare that to the overdose mortality rate among non-residents in the city of San Francisco. We also wanted to compare characteristics of overdose deaths occurring among residents of SRO buildings to overdose deaths occurring elsewhere. And we did this by linking 8 years of drug-related mortality death records with a database of SRO buildings in San Francisco. The key finding of the study was that we found that the overdose mortality rate among SRO residents was about 20 times greater than that of other individuals in San Francisco. And this was true for all the substances we looked at combined, which was opioids, methamphetamine, and cocaine, as well as each one individually. And to put this into perspective, SRO residents at the time made up about 3% of the population of San Francisco, but accounted for over a quarter, about 27% of overdose deaths during the study period from 2010 to 2018.
Dr. Rowe has done some excellent research about the elevated risk of overdose among people who live in SROs in San Francisco. In 2017, Jeff Bardwell and his team at the British Columbia Center on Substance Use actually piloted a program called the Tenant Overdose Response Organizers Program, or TORO, in 12 SROs in Vancouver's downtown East Side neighborhood. In this project, 1 or 2 tenants in each building were hired to work about 5 hours a week as tenant organizers. So they recruited other tenants in their building to come to common areas and get training about naloxone, how to identify an overdose, how to reverse an overdose using naloxone, and how to contact emergency medical personnel. They were also the people that tenants in the building were told that they should reach out to if someone was overdosing. To evaluate this program, Dr. Bardwell and his colleagues conducted focus groups with 15 of the tenant organizers. They also interviewed 10 people who had been through the TORO program and had successfully reversed an overdose for another resident in the building, and 10 people who themselves had overdosed in the building and had their lives saved by someone who went through the program. Participants in this study said that before the TORO program, overdoses were frequent in the building. There wasn't readily available naloxone, and people didn't really know what to do if someone overdosed. But as a result of the TORO program, people really reported having improved awareness and capacity to deal with overdoses. They also said that they really preferred tenant organizers responding to an overdose instead of emergency personnel. One of the other takeaways from this research was that support for tenant organizers was really critical. People talked about how emotionally difficult it was for them to witness so many overdoses and be responsible for responding to them. And they talked about working long hours even when they weren't being paid to do it, just to make sure they were available in case someone overdosed. Especially when they were also witnessing overdoses of friends outside the building, or maybe even overdosing themselves, participants said that they felt really prone to burnout and distress. So people really emphasized that counseling support for tenant organizers is a critical part of the program.
Prior work has documented higher rates of physical, mental, and socioeconomic adversity facing residents of SRO buildings. And I think these findings combined really underscore the heightened risk and vulnerability of individuals in SRO buildings and really call for targeted SRO-specific interventions and strategies to try to mitigate drug-related harms among SRO buildings.